So the study was actually designed to try to optimize management of DCIS. So just as a reminder, DCIS is a non-invasive malignancy of the breast that has no capacity to spread, and the long-term survival following a diagnosis of DCIS is excellent. There has been recent recognition that DCIS has a very variable course between women, and that for many women, DCIS is a very low-risk lesion and often is over-treated with current standard treatment. Current standard treatment involves surgical removal of the DCIS, and if the breast is preserved, it's followed by radiotherapy. And if the DCIS has hormone receptors in it or proteins that bind estrogen, then they also receive medication, typically for about 5 years. So all of those treatments, of course, carry a burden. And our study was intended to try to reduce some of that treatment burden by providing women with information that could lessen the use of radiotherapy. Those are the results I'm going to be presenting tomorrow. The portion about the MRI was presented actually a couple of years ago and has been published. So everyone who entered the study first had an MRI. They had a diagnosis of DCIS, they had an MRI, and based on the MRI, it was confirmed for them whether or not they were eligible for breast conservation or breast-saving surgery. So of the women who had successful breast-saving surgery, we then measured this DCIS Score assay, which involves the measurement of 12 genes that are present in the DCIS lesion, and develop a score that can be classified as either a low-risk score or a high or intermediate risk score. For the women with the low-risk score, we advised them that their risk of recurrence was low enough that they could avoid radiation. And for the higher score patients, we advised them to undergo radiation. And the women in the trial generally followed the advice. So about 93% of the women chose the course that they were advised to take. And among the women with the low score DCIS who were largely not radiated after surgery, the recurrence risk was 5% at 5 years, or about 1% per year, which is a reasonably low recurrence risk. So what we can say to those women is that they did not expose themselves to a high hazard of recurrence within the breast by avoiding radiation. On the other hand, in the women who had a high or intermediate DCIS score and received radiation, their risk of in-breast recurrence, so local recurrence, was reduced quite sharply. Prior studies have suggested that with a high or intermediate DCIS score, the recurrence risk at 5 years would be in the range of 10% or so, about 2% per year. And in this study, when women were radiated, women received radiation to the breast following their DCIS removal, they actually experienced only a 5% recurrence risk. So the rate of recurrence in the breast was sharply reduced with the use of radiation in women with high or intermediate score DCIS lesions. And for those with low risk DCIS lesions, low score DCIS lesions, they experienced a low risk of recurrence. So we sort of achieved the goal of avoiding radiation for those who benefited little from it, and advising radiation for those who would gain from the radiation. And we found that the results played out essentially as we had expected.